Hi, and thank you for joining us. This presentation on leadership and public health is brought to you by the UNF Department of Public Health. It was created by Drs. Colleen Kalynych and Elissa Barr. Leadership is a broad topic and can be discussed in many ways from different angles. Today's presentation will discuss some basic concepts of leadership and how it relates specifically to public health practice. At the end of this presentation, participants will be able to discuss a working definition of leadership, recognize the importance of leadership skills in public health, and finally, describe selected leadership theories and how they apply in public health. Leadership is a journey and is needed within all levels of an organization. While leadership may not be for everyone, it is essential for the growth of an organization and assists with growth at the individual level. Leadership skills can assist one in being more productive and feeling more fulfilled. While some may feel more inclined towards a leadership role, a good leader recognizes the importance of training and purposefully working at being a competent leader throughout their career and lifetime. There are many definitions of leadership and just as many books. If you Google leadership books, you'll find thousands of options ranging from textbooks on leadership to the psychology of leadership to books from proclaimed leaders and more. Some focus on leadership traits, behaviors, and/or styles. Amazon alone has over 60,000 books available regarding leadership. These are just a few leadership definitions from some of the top speakers regarding leadership over time. I will let you read these later on your own, but we have highlighted some common words: process, influence, common goal, vision, and success. We also see the concept of leaders and followers. Stojdil is famously credited with saying, "There are almost as many different definitions of leadership as there are persons who have attempted to define the concept," with the number of definitions continuing to expand even today. In regard to leadership and public health, again, there are many definitions of leadership as it relates to public health. But here we begin to see the shift to include not just personal behavior, traits, or skill, but the inclusion of communities and agencies or organizations as a whole or as systems. We see this shift from the leader-follower concept in general leadership definitions to a broader impact or influence on the more global level here. To get us started, here are some general or common components of leadership. First, expressing leadership is a process. It reinforces the concept that leadership is not a particular trait or characteristic, but instead a transactional event occurring between leaders and followers. The leader affects and is affected by followers as an interactive two-way process. This therefore suggests that leadership is attainable by anyone, not to only those born leaders. Second, influence is central to leadership and must be present. Third, leadership is primarily defined as occurring at the group level, where the leader influences a group of individuals who have a common purpose. For example, in public health, this may be as part of a coalition within one's organization, whether it's nonprofit, for-profit, or a governmental agency, or within a task force. However, it is also recognized that individuals can be influenced by their leader at the individual personal level toward future goals, perhaps in a mentoring role. Fourth, goal attainment. This involves the leader providing direction and guidance towards accomplishing tasks towards a common goal and/or common vision. Finally, and in terms of public health, adding the inclusion and impact of communities and systems at the local, national, or global level. So what will be your personal definition or philosophy of leadership? Taking the time to develop your own definition or philosophy and guiding principles can keep you on a plan for continuing to grow as a leader. We may wonder, why is leadership important to the health of the public? Due to the complex, interdependent systems within public health at all levels, local, national, and international, public health institutions need to be dynamic, multidisciplinary, and interprofessional. This requires a workforce that is strong in management and leadership skills to develop partnerships and cohesive teams. This will help to maintain current programs and resources, while also being able to adapt to current needs. In the seminal report, The Future of Public Health, it was recommended, among other items, that we as a nation focus on educating the workforce on management and leadership skills, as public health requires high political acumen, the ability to motivate and lead personnel, to plan and allocate agency resources, to sense and deal with changes in the agency's environment, and to relate the agency to the larger community. In the future of the public's health in the 21st century, the report notes that leadership from public health sector is critical to inform the nation with their expertise and to be part of the natural conversation to assure an effective public health system. As noted by Johnson and Davey in Managing Public Health Organizations, in order to effectively address both current and emerging health concerns, public health approaches involve multi-level systematic interventions that address the individual, the community, and public policy. These activities require advanced leadership skills and effective managers within the various systems. Further, the Future of Public Health report reinforces the importance of leadership in influencing and motivating the workforce. Investing in leadership training programs within one's organization empowers and invests employees in the organization. As the title here reads, greater emphasis in public health curricula should be placed on managerial and leadership skills. This includes the ability to communicate important agency values to employees and to enlist their commitment. A question to consider is, have things changed? In the document, Public Health Leadership in the 21st Century, we find that leadership is still a critical need and that those who choose the leadership challenge understand and respect the 7 unique features of the field described by Turnock. These 7 items include social justice, grounding in data and the sciences, a dynamic and ever-expanding agenda, the link with government, the use of prevention as a prime strategy, the inherently political nature of public health, and the uncommon culture and bond of public health. Strong leaders and managers, therefore, can lead and implement the core functions of public health and the 10 essential services critical to a strong public health system. These are presented by the CDC at the link provided here. Here's a quote we'd like to share. Leaders empower individuals by building trust and coaching competence in their job roles and networking skills. Building a competent workforce is essential and can start in our public health schools. You may be asking, as many people do, is there a difference between managers and leaders? While leaders can manage and managers can lead, each has different and distinct purposes. In the book Leading Change, the author, Cotter, suggests that managers produce order and consistency. They do this by keeping the organization running smoothly. Managers pay close attention to number 1, planning and budgeting, number 2, organizing and staffing, and number 3, controlling, and problem solving. Leaders, presented on the right, produce change and movement. They help define what the future looks like by, number one, establishing direction. This is done by helping create a vision and mission, clarifying the big picture, and setting specific strategy. Leaders also help define the future by, number two, aligning people to the vision. Here, leaders communicate goals, get commitments from individuals, and they build teams with others. And finally, number three, leaders help define the future by motivating and inspiring the workforce to make it happen. They energize the workforce, empower upper management, and help satisfy unmet needs. Collectively, these efforts produce change. Now let's look at leadership theories in public health. This information addresses specific characteristics of leadership. You may recognize some of these general leadership theories that have existed over time. They range from, on the left-hand side, the great man theory, where men were essentially the only leaders. To the right-hand side, we see the transformational theories. In these theories, the leader engages with others to create a connection to increase the level of motivation and morality of both the leader and the follower. The goal is that the follower reaches their highest potential. In any leader-follower relationship, there is a degree of power. This is often present. However, power should be included in the skill set of leaders, yet the different types of power should be used appropriately. Power should never be used for corruption or to achieve goals unrelated to the mission of the organization. Here are some different types of power. Legitimate power. This refers to the official position within an organization. Often, an organizational chart will delineate power within the organization. The next is reward power. This type of power refers to the ability to reward behavior through pay, bonuses, and promotion. The third type, coercive power. This power is used to punish followers for not doing what the leader wanted, or what the person is expected within the organization. This may result in demotion or termination. The fourth, expert power. This refers to having a specific knowledge required by the organization. And number five, referent power. This refers to having charisma, where you may create admiration, loyalty, and a desire for followers to copy you as the leader. Those in public health need to have a clear understanding of power and its uses to help achieve a fair, strong, and accountable organization. To review all leadership theories is beyond the scope of this presentation. Therefore, we will just review a select few. Leaders in public health need a high degree of authenticity, trustworthiness, and intelligence to be effective in such a changing position. The ability to build relationships within the organization and outside is essential. Since leaders are necessary throughout the public health agency at all levels, we'll cover a few leadership theories for consideration. These include the 5 practices of exemplary leadership, authentic leadership, servant leadership, situational leadership, and emotional intelligence. So here is the first of 5 theories. The authors of the Leadership Challenge conducted studies throughout the Leadership Practices Inventory to determine what leaders did when they were serving as the best leaders. From over 550 leaders in a variety of organizations, they found these 5 similar patterns of behavior. Number 1 is model the way. Leaders should be clear about what they want and who they are as a leader. What are your guiding principles? What are your values? You should understand who you are first, then you can share with others and model the way. Number 2, inspire a shared vision. Leaders envision the future by imagining and embracing the possibilities. They understand the past, but also have a clear image of what the results of a new endeavor will look like before starting any project. You have to inspire a commitment to enlist others into a vision. Number 3, challenge the process. Change the status quo. No one achieves their personal best by staying the same. Leaders are pioneers. Search for opportunities and innovative ways to improve. Number 4, enable others to act. Achieving greatness is not done in solitude. It is a team effort. It also requires trust and enduring relationships. Leaders foster collaboration and accountability among their team members. In this process, the team continues to develop and grow. And finally, number 5, encourage the heart. Genuine acts of caring brings people forward. People want to know that they are valued. Leaders recognize the contribution by showing appreciation for individual and group excellence. Kouzes and Posner state that exemplary leader behavior makes a profoundly positive difference in people's commitment and motivation, their work performance, and the success of the organization. Leaders who utilize these 5 practices are considerably more effective than their counterparts who use them less frequently. Here is the same theory again. The authors further break down these 5 practices by adding 10 commitments of exemplary leadership that are encased within these 5 practices we just discussed. These 10 commitments are described in more detail at the link presented that you see at the bottom of the slide. Also, reading the book, The Leadership Challenge, and Taking the Challenge provides excellent practice for leaders. Finally, taking the leadership practice inventory yourself, which is shown at the top right of our screen, can provide valuable insight and feedback. We encourage you to review both of these links on your own. As we saw in the 5 practices of exemplary leaders, genuineness is an important attribute. Our second theory, authentic leadership, focuses on whether the leader is genuine and real, and in general is about authenticity. This theory emerged in a time when many companies and their leaders, like WorldCom, Enron, and banking institutions, were failing and were deeply seated in corruption. While authentic leadership seems like a simple concept, there is no single definition. We'll only cover one approach, Bill George's authentic leadership approach. This model focuses on the characteristics of authentic leaders. They, number 1, understand the purpose. Number 2, have strong values about the right thing to do. They use their heart and compassion. Number 3, they establish trusting relationships with others, so they really establish that connectedness with people. Number 4, they demonstrate self-discipline. They are consistent and act on their values. And finally, number 5, they're passionate about their mission. They always go back to the purpose. George suggests that authentic leaders know their true north. It's essential that public health leaders are seen as genuine and trustworthy, not only among those within the organization, but importantly across organizations and within the community. Our third theory is servant leadership. Greenleaf comes from the perspective that one wants to serve and to make sure that others' needs are the priority. Servant leaders put the good of the followers over their own self-interests and ensure the development of the follower. As a philosophy, others have sought to define it as a theory. Spears, in 2002, identified 10 characteristics from Greenleaf's writings that were central to servant leadership. This video helps describe servant leadership more thoroughly. Servant leadership is a central tenet in public health service. we serve others and their health first. For more information on this theory, you may come back to this link and watch the video. Our fourth theory, situational leadership, suggests that different situations demand different kinds of leadership intervention. The situational leadership model can best be described in two sections. Number one, leadership style, and number two, development of subordinates. The leadership style represents the tactics a leader can take when influencing others. There are directive behaviors or tasks and supportive behaviors or the relationship type. Directive behaviors help to clarify and are more one-way communication from the leader or manager to those completing the work, whereas supportive behaviors are more two-way communication and are designed to make the group or person more comfortable and confident. The four quadrants you see here represent the degree to which these behaviors need to be implemented, or the style in which the leader may need to take. They include directing, coaching, supporting, or delegating. These quadrants relate to the developmental levels at the bottom of the grid, suggesting, for example, that an S1, shown in red, would represent an employee or group in D1, where there is low competence but high commitment to completing the job or tasks, but needs a higher degree of direction. Your leadership direction needs to match the performance needs of the individual or the group. You may find that you have different styles with the same person based on different projects or situations. Public health workers find themselves in many challenges, like new projects, less money, or a crisis. Thus, being flexible as a leader to provide the right support and direction for the right situation will go a long way in having employees who will grow with your organization and keep morale high. Again, here is a link to a video that you may want to come back to with more information on situational leadership. Here is our fifth and final leadership theory to discuss. Emotional intelligence, popularized by Danielle Goleman, is our ability to really understand our emotions and apply this understanding to life's tasks. Specifically, Norhaus states that emotional intelligence is the ability to perceive and express emotions and to effectively manage emotions within oneself and in relationships with others. Goleman describes 4 core competencies to enhance leadership. These include self-awareness. This is the ability to read one's emotions and recognize their impact. Self-management. This includes controlling one's emotions and impulses and being able to adapt to changing situations. Social awareness. This is the ability to sense, understand, and react to others' emotions while taking the social implications into context. And finally, relationship management. This is the ability to inspire, influence, and develop others during conflict. It's impossible to remove our emotions, but you can learn to control them and put them in context. It is essential for public health leaders to have high emotional intelligence to work with various organizations and communities to help them solve complex problems across systems and think strategically. Highly effective leaders most often have high emotional intelligence. Lewis Rowitz suggests there are 5 leadership essential skills. Now that we've looked at 5 different theories, here are 5 skills to remember. He is the author of Public Health Leadership, Putting Principles into Practice. So the essential skills include, number 1, the ability to identify the most useful information and to use it. With the tremendous amount of information the leader has to sift through, the leader needs to be able to translate this information into the context of public health and the governing paradigm. Number 2, The second essential skill is the ability to motivate and work with others. Relationships with colleagues and partners is paramount. Leaders must have social skills or emotional intelligence to be a public health leader. The third is the ability to take risks and follow through. Leaders need to be visionary and creative, but take risks by translating creativity into well-defined projects and outcomes. Number 4, the ability to communicate at many different levels. Leaders should be able to communicate verbally and in written form, to listen to others, and to be good storytellers. And finally, number 5, the ability to act as system thinkers with an understanding of how complexity affects work. Leaders should have the ability to look at their agency or department as a whole within the context of their own agency, but also within the community. Today, we've provided a broad overview of leadership and public health. We've covered leadership definitions in general, those within public health, and challenged you to develop your own guiding principles. We discussed the importance of leadership in public health, and finally, we discussed selected leadership theories and approaches that are relevant to public health practice. At the beginning of this presentation, we suggested that leadership was a journey. Coach Wooden reminds us, those who aspire to be leaders can do it. Those who wish to become better leaders can also do it. Those in public health need to recognize that leadership skill is critical to the continued advancement and improvement regarding the health of our nation and the world. Nelson Mandela reminds us that leaders can make a difference in people's lives, and we hope you decide to take the leadership journey. Thank you for joining us. Here's a list of our references, and we do encourage you to come back to this webinar to review the materials that we've referenced throughout and to watch the videos at the links provided. Thank you for your time.